Good evening and welcome to Gwinnett County Public Library's Meet the Author series. My name is Denise and I'm in charge of adult services for the library system, and we welcome you. Our author tonight is Polly J. Price, an award-winning legal historian and professor of law in global health at Emory University. Her writing has appeared in The Atlantic, The Hill, Newsweek, and the New York Times, among many others. Connect with her online at plaguesinthenation.com or follow her on Twitter at Polly J. Price. Her new book is Plagues in the Nation: How Epidemics Shaped America. Welcome, Polly J. Price.
Thank you. I'm delighted to be here. I very much appreciate the invitation to be with the Gwinnett Library System and for sponsoring these series of talks. So I started this book years ago, well, 4 years ago to be precise, well before COVID. And I want to explain a little bit about why I undertook the project. I had looked at and studied epidemics in the United States, and my takeaway from that had been our legal system, our laws and legal system are not ready for another big epidemic, pandemic on the scale that scientists have been predicting. And so the book should have been out before COVID hit, but it was not, much to my publisher's consternation. But I did explain to her that I thought it was a better book because of having experienced COVID. There were a number of things that surprised me about it, even after studying and being very familiar with our legal system, and I'd be glad to talk about those later in the program if there are any questions about that. But I did want to write the book to say it is important to understand how we got here, and to look at the long history of epidemics in the United States and the government response to them. And what has been, of all the variety of epidemics, of outbreaks, contagions, plagues, pandemics in the past, what are the things that have been, that we've sort of encountered over and over as similar problems? And I think that what I will do is I want to go through some of those earlier epidemics that I talk about in the chapters in this book, and then I will talk about my conclusion about what those were, and you may have thoughts of your own about what those are. But in terms of looking at the government response to epidemics in the United States, very long history from beginning in colonial times that I take a look at in my book. There is of scarlet fever, typhus fever, polio, diphtheria. For those who are tired of hearing about COVID, of talking about COVID, be reassured, there is only one chapter in my book about COVID. It's the last chapter in the book. The other chapters talk about our history of other epidemics, and these are among some of them. So from the colonial period to the Civil War, there's really not much that medical science can do for helping folks both avoid the plagues of the day and also to have any hope of a cure or any hope of prevention, just not really something that medical science was able to address till towards the end, closing decades of the 19th century. But of all of these various quarantinable diseases that local public health officials dealt with, smallpox through the early 20th century, through the middle of the 20th century really, was one of the worst, absolute worst. And I wanted to read just a couple of short excerpts from my book. I think those of you who are local to the Atlanta area may appreciate some of these stories, because I do tend to focus, having done a lot of my research here, throughout the book you'll see vignettes and stories of what happens to some people during these episodes that have been is focused on Atlanta, Georgia, and the Southeast. So this is a discussion about smallpox specifically. And when we looked at the beginning of the COVID pandemic and saw that there was, at least the very earliest months, there was a very draconian crackdown in Wuhan, China, I got some calls from reporters asking me, could that happen here? And the short answer was no, and it really couldn't in terms of our legal systems and protections that individuals have. But you may be surprised to learn about the early history. So let me just read a few things to you here. Elected officials often took extreme measures because their constituents demanded it. After Captain Robert H. Blandford, a Union ticket agent, died of smallpox in 1905, residents of Winton, Georgia, demanded that armed quarantine guards be placed outside his home. A meeting of concerned citizens demanded the guards after Mrs. Blandford took in a young married couple as boarders following her husband's death. The young couple contracted smallpox and were taken to the pest house. A local newspaper reported that all the bedding, carpets, and in fact every article in the rooms will be burned. Pestilence victims were also driven away from populated areas by terrified and enraged citizens. One tragic case involved a wagon driver in Georgia who appeared to be suffering from smallpox. Local residents refused to let him continue his journey home, forcing him into an abandoned barn. He died there without any aid. The local citizens then burned down the barn with his body in it. One could even be shot for attempting to escape a quarantine with apparently no legal repercussions for the shooter. In 1895, a quarantine officer named Horace Turner shot and killed Caleb Norman at Walls, Mississippi, after Norman escaped from a smallpox quarantine camp. Norman had been run out of Arkansas, then driven away from Cow Island, 18 miles south of Memphis. Mississippi authorities refused to let him into that state, but he could not return to Cow Island or Arkansas. A newspaper reported that Norman had attempted to run the gauntlet and was shot and killed. No wonder people tried to hide their illnesses from the authorities, helped by family members or friends who refused to report them. And when I mentioned earlier that medical science of the day offered little help for many of these diseases that would sweep through communities, smallpox is actually different because there was a vaccine available starting in the late 18th century, but certainly in the 19th century. And there's a very interesting history of compulsory vaccination laws, not just in Georgia, but throughout the United States towards the end of the 19th century. I'd like to read a short excerpt here about a Georgia Supreme Court case. It was one of the first in the nation as far as I can tell, to have addressed the issue of, is it constitutional to require all of the citizens in a town to have compulsory vaccination? The answer of that court was yes. Only later would the United States Supreme Court address the same issue and come to the same conclusion. But if you'll bear with me, I want to read just a few paragraphs here. As confidence in vaccination for smallpox grew in the 19th century, local, state, and even federal authorities mandated vaccines and financed them at least partially. Some cities required all of their residents to be vaccinated when smallpox appeared, and legislatures authorized school boards to require vaccination of students. Employers in mills and factories would purchase vaccine for employees, as did slave owners on large plantations. In Georgia, the state legislature authorized cities and counties in the state to order compulsory vaccination of all residents in the event the health officers or the proper authorities think it advisable to prevent the spread of smallpox. The Atlanta City Council, confronting a series of smallpox outbreaks in the 1880s, made vaccination compulsory for anyone over the age of 15. The penalty for refusal was a fine of up to $500 or 30 days in jail. A second refusal merited the same penalty. The practical result, a journalist noted, is submit to vaccination or stay in jail. The ordinance applied to any person over the age of 15. In 1897, Mayor C.A. Collier saw to it that policemen accompanied the 100 physicians who canvassed the entire city to see that the doctors are protected and to aid in the work of vaccinating. They would Usually these would take place on a Sunday when people might be more likely to be at home, but they would go from neighborhood to neighborhood accompanied by these policemen. And if you refused, you would go to jail. No one really paid these fines, as far as I can tell. They're really, I mean, $500 was just an enormous amount. But it could be very persuasive in terms of, if you want out of jail, submit to vaccine, or you get another 30 days, another 30 days, another 30 days until the emergency is over. So it was about 8 years after the Georgia Supreme Court passed on this and said these laws are constitutional. In fact, that it is the public necessity, it's the demand of the emergency that allows the elected officials to require vaccinations for the public good. And the author of the opinion for the Georgia Supreme Court first noted that every state in the union seemed to have similar laws, where a state legislature would allow the cities, if they encountered a smallpox emergency, to pay for and require vaccination. That many of them had these laws, but also that these were in fact this did not violate your individual rights. Why did it not violate your individual rights? Because the community had a collective right to, and it was the safety of the community that the public officials, elected public officials, were charged with protecting. And as the Georgia Supreme Court said, if you don't like this situation, the answer is at the ballot box. The answer is not for judges to overturn these kinds of decisions. And it's interesting that that preceded by 10 years or so a very famous Supreme Court case that you may have heard mentioned in connection with more recent events with the COVID pandemic. It's called Jacobson v. Massachusetts, and it's a very similar situation in that a fellow named Hemming Jacobson challenged a mandatory vaccination requirement in Cambridge, Massachusetts, that had been ordered because of a local outbreak there. He managed to get his case all the way to the U.S. Supreme Court. And the U.S. Supreme Court, in their decision, said, sounded very similar to what the Georgia Supreme Court had said already, which is we are not in a position to judge these kinds of matters, whether the necessity, the science, et cetera. That's what elected officials do. And we should give them wide latitude to make these kinds of decisions. Not that there were no limits on what a state or a local health official could order, but just that this did not violate those limits. The fine there was $5, not $500 like Atlanta, and there was not really a jail time at issue. It was, pay the $5. And you could go on your way. So the Supreme Court had a slightly different take on it from the Georgia Supreme Court, in the sense that it was looking at a different case. On the other hand, it is 100 years later, during the COVID pandemic, that was the last time the United States Supreme Court had ever made a pronouncement about the powers of public health officials during a pandemic. So with COVID, when cases came to courts again, that was the primary precedent that courts had to work with. Okay, well, I want to move on to going past smallpox. One of the next major episodes of epidemic outbreaks in the United States was yellow fever. And it occurred in the 19th century, primarily in the Southeast. Now, there's a sort of famous episodes in colonial and early American history of yellow fever. Congress fled Philadelphia once for a yellow fever outbreak. So we've seen it disrupt government further north. But by the late 19th century, it's primarily a southern phenomenon for whatever reason. But it was almost an annual threat. Well, it was an annual threat. And so typically, yellow fever cases would come in through port cities like New Orleans, Pensacola, or Savannah. And at the first report of a yellow fever outbreak, yellow fever cases in those cities, cities further north would throw up what they called, well, they came to be called shotgun quarantines, and that's what this slide is illustrating here. It's a newspaper headline: "Shotgun quarantine and war on yellow fever, thrilling phases of the battle being waged in the stricken districts of Louisiana." Literally, there were shotguns, but they typically were not fired, and not actual battles. But they called it a shotgun quarantine because towns, also guarding of state lines, but mainly towns further north, would essentially declare a quarantine against anyone coming from these areas with yellow fever. They would not let them into the town. They would not let trains stop. They might make trains stop at the state line. If shotguns were involved, it was usually there were sort of armed vigilantes that were enforcing these. It wasn't always vigilantes. It was quite often following the vote of a city council, or even state governments got into the action and would declare. It was very common for, like Georgia, for example, the first hint or the first report of any case from New Orleans, Georgia, would declare quarantine against Alabama, Mississippi, and Louisiana. And it would be at the state line of Georgia, and vice versa. Now, this is in terms of, here's some pictures or just some images. There's one with a shotgun. You can see they're turning it away, and you can't read the legend there, but it's turning away refugees, which is, by the way, the first time I've seen refugees applied to U.S. citizens within the territory of the United States. Historically, would be the middle of the 19th century. It would get so bad that the federal government would sometimes help to set up camps for these people who were trying to escape, say, Pensacola, Memphis, New Orleans, but couldn't go anywhere because no other city would let them in, or they couldn't, weren't able to get, trains weren't able to go through. The federal government would set up some, they called them refugee camps. So that's the first time I've seen that talked about. And there you can see it with respect to trains. The usual would be either to just not let the train stop, or including disrupting U.S. mail. And so these were very disruptive economically, very harmful to the South. And yet it was hard to break that cycle of this reflexive quarantines being declared against each other and just shutting everything down. But it was because of panic and fear. They did not know how yellow fever was spread. Turns out it was spread by a mosquito, but they didn't know that. They just assumed it was person to person like smallpox was. And so they were partially right in the sense that the mosquitoes needed people who were infected to then pass it along, but nonetheless, it was they believed that by sort of preventing people from coming in, they could keep the contagion out, and so they acted accordingly. Well, this is one early manifestation of maybe what we might think of as the utility of our COVID vaccine cards or our smallpox vaccination status. This was a yellow fever immunity card. So it turns out that it was believed that if you've had a case of yellow fever and survived it, you were immune. All right, there's no vaccine yet. But they wanted to recognize this and make travel easier for people who had already survived yellow fever. So states would come up with what they called these yellow fever immunity cards. This one is from Florida, and the idea was it would help their residents travel out both within Florida and then outside of Florida. So one of the things I want to point out to you is, so this certifies that John Caro, a native of Florida, resident of Pensacola, Florida, experienced an attack of yellow fever at, it looks like Warrenton, Florida, in 1863. All right, so you have your attending physician would sign, and then also the state health officer. But it became apparently quite a racket to be able to get these cards by paying someone, physician or not, to sign as the attending physician. And if you look at the reverse side, this card is from 1899, and it's certifying that you had a case of yellow fever 35 years ago, right? So it became, in terms of the value of these cards, most people pretty quickly grew to be very skeptical of whether these were genuine, or because they could be bought on the black market, essentially. So they were not terribly useful in opening up the economy and allowing people to travel. So this is I think one of the single most interesting things to come out of this, the decades of experience that the South had with yellow fever is this. Over a period of time towards the late 1890s, early 1900s, the states would call conventions of like yellow fever quarantine convention, essentially to discuss what they might do and how they could better address this situation. And they come up with this several years in a row. They petition Congress to take over federal quarantine, interstate quarantine between the states because of the severe economic harm that they suffered year after year after year. So if you know, as you appreciate Southern history, this time period is very rare to see the South ask the federal government for help on anything, especially to give up control over something to the federal government. But that's how serious this situation had become. Well, I'll move on to talk about some of the other epidemics that the United States experienced. You probably heard more about the 1918 flu over the last couple of years than you had in a while. And it's because there were many parallels in the sense that you saw, as this headline indicates, influenza epidemic closes schools, churches, theaters. You see that face masks were required in some cities and not in others. But these were measures that local governments would try to take to stop the spread of the disease. You might be interested to know in terms of what was happening in Atlanta. This is a headline from the Atlanta Constitution. This is, the headline reads, "Public gathering places closed by city council for 2 months." The orders adopted to stop the spread of what they called the Spanish flu, now raging here. Unless otherwise changed, instructions will shut the doors of movie theaters, schools, churches, pool and billiard parlors. And the council's order follows the health board's action. So the city of Atlanta had its own health board that recommended these measures. The city council voted them in. They were actually in place for about 3 weeks. The face mask requirement particularly was in place for about 3 weeks, and then the mayor at the time, Mayor Candler of Coca-Cola fame, reversed the city council's order because he said it was more or less not necessary and was harmed the economy, harmed sort of local businesses. And so we've seen a lot of that same debate repeated at the state and local level. But again, it sort of illustrates what the Supreme Court had said in Massachusetts versus Jacobson, which is these are not matters for courts as a general rule. These are, we should allow public officials the leeway to deal with these because we are certainly not experts in these matters and we are not elected officials. So again, the remedy, if you don't like the kind of leadership you have on these issues, the remedy is at the ballot box and not the courts. So certainly by the end of the 1918-1919 flu, that proposition is very well established, certainly in the federal courts, but also in the state courts. The proposition that if it's an epidemic emergency, public officials, elected officials, are going to have a lot of leeway to meet that emergency. Now, if I were going to just say I'm teaching a law class on what is public health law in an epidemic, what were the kinds of laws that I thought were so antiquated that I needed to write a book to point out the problems that we have. Well, here's the basics. The unique system of federalism in the U.S. makes it one of the most decentralized public health systems in the world. Why does that matter? If you have one of the most decentralized public health systems in the world, that might partially explain why the U.S. performed relatively poorly compared to other wealthy industrialized nations, right? Because we don't have a public health defense system in the same way that others do. Ours is very decentralized. And specifically, this is what I mean by the decentralization. America's defense against the spread of contagions is divided among 2,684 state, local, and tribal public health departments. Each one of those is responsible for its own territory, detecting an outbreak, containing the outbreak, testing to see who else might be exposed. That's part of the containment process, right? If somebody is contagious, we would, the public health department might need to ask them to quarantine. The public health departments were most familiar with quarantine prior to COVID from tuberculosis. So tuberculosis is a disease that every public health department in the United States has dealt with at one time or another, some more often than others. But it requires, so someone has tuberculosis, if they've been tested positive, treatment for tuberculosis is generally a year. It's onerous. You have to take medication every day, daily observed therapy. And if you develop drug-resistant tuberculosis, or if you acquire drug-resistant tuberculosis, it's far worse than that. But it's been kept at bay in the United States. Tuberculosis is a huge problem globally. And drug-resistant tuberculosis, again, very significant problem globally. It's under control in the US, but it's fairly precarious, and people worried about our ability to control tuberculosis, given that we rely on these 2,684 state, local, and tribal public health departments to both identify the cases, trace the contacts. But when you have a mobile society, what happens? Well, people move to another health department. You might lose track of them. In the city of Atlanta, for example, about a dozen years ago, there was an outbreak at one of the downtown homeless shelters of a drug-resistant form of tuberculosis. Took a while to figure out what the problem was, where it was coming from, how to control it. 8 years later, it was discovered that the patient zero from Atlanta, the genotype that the CDC had helped sort of figure it out, had spread to 11 other states in that short amount of time. 11 other states, 10 people died, and it all came from patient zero at one downtown urban shelter. So the point being that wherever you are in the United States, it's the local health department that's in charge of that jurisdiction, and that we hope is interdicting these kinds of contagions that are spreading to other states. On the other hand, some health departments are very well run and well financed, and some state legislatures vote lots of money for their health departments, but many don't, and many aren't run very well. And so the weakest link is what determines the fate and the outcome, typically, of epidemics in the United States, or at least the ability of how do we stop the spread from one state into another, from one jurisdiction into another, and that's how we do it. Okay, so other questions that often came up during COVID, and these are questions that had encountered again and again in our previous experience. Who has the authority to order social distancing measures? And in terms of basics of epidemic law in the United States, for mitigation measures such as non-essential business closings, face mask ordinances, state, municipal, and county governments can usually make their own decisions. So that has been a prominent feature throughout U.S. history. Now, we started to see some differences with COVID with respect to governors and legislatures at the state level directing rules that would apply statewide. Okay, that in many places was different from the tradition of local control. But here's what I think surprised most observers the most about how the legal response to COVID worked itself out in the U.S. And it's this: all 50 state governors declared states of emergency in March 2020. All emergency declarations were extended for well over 1 year. So there are two things are noteworthy about this. One is, never before in U.S. history had all 50 states had a state of emergency at the same time. And never before in U.S. history had any one state had a state of emergency that lasted over a year, or even over a few months. Because a state of emergency, you may be familiar with this, but it's essentially, these are laws that are designed to respond to temporary emergencies like hurricanes, fires, floods, tornadoes. So they usually only last a very short time, but they give governors extraordinary powers. When you have them lasting well over a year, you can understand why the legislature would then want to have some say in what the laws are, okay? Because a state of emergency allows the governor to sort of bypass what are normal state legal processes and rules. So that was one of the major sort of differences in terms of how this epidemic was handled versus in the past. And I think that surprised a lot of people because it ended up being governors making a lot of the orders on their own. Here's one of the results, and if you want to take a look at this map, I want to point out what it came. This is very early in the pandemic, and how do we know it's very early in the pandemic? Because if you look at this screenshot of states under stay-at-home order, most of the states are under a stay-at-home order. It's so early in the pandemic that the deaths are 7,159, and we're well over 1 million at this point. So that's how early in the pandemic it was. But that's fairly uniform in terms of an early response compared to what happened soon thereafter. So now these are state social distancing actions from about a year. If you just look at the different colors, you can see that the United States is responding in many different ways. And that's, again, what our tradition of local control would suggest. It's not necessarily a bad thing. It's the reality, though, that we will deal with. So this is just an example of the variety of social distancing. Here's mask and face covering mandates. Again, the predominant is no mask mandate. That's in the dark colored, but you can see, again, more variety. This is the one that I think has interested me the most. Is the travel restrictions that were implemented by states in response to COVID-19. Because I really, one of the first history research areas that I had was the shotgun quarantine of the 19th century, where literally stopping people at state lines from coming in, stopping people from crossing city, town limits and so forth. And here's what we saw with COVID. Okay, so many states would have some sort of quarantine requirement for travelers coming in from other places, even their own returning citizens. What we forget, I think, is that early on, Florida and Texas were among the first states to impose these kinds of travel restrictions on people coming from New York, coming from the Northeast. And then I suppose turnabout is fair play, because after New York gets back on its feet and has had, they had some of the most stringent rules and regulations in the country, then you start seeing this, where Chicago, for example, saying if you're coming from any of these areas with high COVID, you've got to quarantine for 14 days. Same thing with New York State. And you can understand why they would want to do that. They've sacrificed a lot. If they've had more business shutdowns in other places, they're not very tolerant of COVID coming back in the back door from places that were less stringent in terms of how they protected their citizens and protected the economy. Well, this is circling back around, and I'll sort of wrap it up here. Chief Justice Roberts in May 2020, so there are a number of cases that started to trickle up to the Supreme Court about these restrictions. Are they legal? Can federal government, state government, local government order these various things? The Supreme Court has not had a sort of full opinion or an opportunity to decide one of these cases in full, but there have been a few things along the way in terms of orders that temporary orders that they're responding to. So let me just start with this. This is what Chief Justice Roberts had to say in May 2020, and he is quoting from the case I told you about earlier from 100 years ago, Massachusetts v. Jacobson. He's quoting from it. Our Constitution principally entrusts the safety and the health of the people to the politically accountable officials of the states to guard and protect. When these officials undertake to act in areas fraught with medical and scientific uncertainties, their latitude must be especially broad. Where those broad limits are not exceeded, they should not be subject to second guessing by an unelected federal judiciary, which lacks the background competence and expertise to assess public health and is not accountable to the people. It's not quoting, all of that is not a direct quote from Massachusetts versus Jacobson, but that was the primary case that the court looked to. And it's the same principle that he's announcing, is to say, look, it's, you know, these sorts of things are for the elected officials within broad limits. Right, because there's all of this uncertainty, and we are not going to be in the position of deciding among the various competing theories of what's the best thing to do. But then, with the change in composition of the court, Chief Justice Roberts then became a consistent dissenter, as the Supreme Court, in a few cases, had basically overturned state and local governments' limits on church gatherings and religious worship. So it's basically a First Amendment religious objection, protecting that value from the Supreme Court's perspective, and not a broader statement about what local officials can do. But here's the dissent, and he says, here, as in related contexts concerning government responses to the pandemic, my view is that courts owe significant deference to the politically accountable entities with the background competence and expertise to assess public health. So that's a pretty straightforward idea that we've had throughout U.S. history, which is, again, it's elected officials are in charge. They may be good, they may be bad, they may be competent, they may be able to follow the science or not. We need them to look out for the economy as well as the people's health and so forth. That's always been in the United States. Where it has stopped is the political question issue, and then also with the sort of fragmented nature of our response. I think local government control that explains the norms that we have had. So I appreciate your indulgence in listening to me, and I'd be delighted to take any questions if you have any.
Yeah. How do you personally feel about leaving your health, the health of our citizens, to politicians?
Well, I don't know a better way in the following sense. I would like for our politicians to be getting their directions from a trusted scientific source. And so in most states, for example, the state, either the statutes or in some instances perhaps the state constitution requires the governor to consult with the director of the Department of Public Health. All right, but there's nothing that requires the governor to do that. Would it be better if there was, you know, if health officials had more direct charge? Probably, but then again, they're not elected officials. And so, as the courts have said, if you can't turn to the courts for a remedy, your remedy's at the ballot box. On the other hand, I don't know that people, when they're thinking about, you know, voting for mayor or for others, that they're thinking about, I wonder how well they would do in a pandemic. You know, they probably aren't thinking about these things. So, I mean, I guess what I feel about how having elected officials in charge is, I think it would be like truly revolutionary in the United States to have it any other way. But on the other hand, it would be, I would be more comfortable with, I think, particularly in states, some greater obligation of the executive branch, of the governor's branch, the governor's office, to consult with the state public health department and at least make sure that they have a role and that they can be heard and that they are not, you know, that they're independent as well.
And how did other countries do better with this, so, like England and socialized medicine?
Well, other countries' numbers were better. You know, like the mortality rate might be lower. Or, and again, not just total number of cases, but population-based statistics. Our number of deaths we account for a larger percentage of global deaths for COVID than our population should account for. On the other hand, we also know that we did poorly in particular areas, prisons, among the elderly in retirement homes and other places, nursing homes and so forth. So I don't know what the answer is in terms of how did other countries do better? How did they do it? But to be able to have a uniform quarantine policy, for example, throughout an entire nation, like Great Britain. If you look at Australia and New Zealand, they had geographic advantages to their quarantine policies that just wouldn't be possible in the U.S. And so it is probably true that some of the nations whose numbers at least are better, assuming that all the numbers can be are accurate and that we can credit those, they probably paid a greater economic price. So there were always those trade-offs, keeping your economy going, in part, if nothing else, just to try to keep the lowest socioeconomic group from just being utterly devastated, right? So just things that you would try to undertake. So I don't know the answer to that, other than I think that having a unified public health system, unified rules throughout, being able to very early on distribute supplies in a fair way is just much more difficult in a federal system like the United States.
So as you're writing your book, the actual pandemic happens. So what were some of the surprises that you had from the response and the policies that states or on the federal level enacted?
So the question was, so writing my book, as I mentioned at the beginning, I was in the midst of, had done the research and was preparing to write when the pandemic hits. So what was it that, I think it made it a better book, or at least I told my publisher that. But I honestly believe that because of the number of surprises I encountered. Like, I would have gotten that wrong in the book if that had come out. The first one is that slide that I showed you earlier about the state governors declaring states of emergency and then ruling by decree for over a year. It's like, had anybody said that would happen in the United States, I would have been among the last to believe it. And yet it sort of made sense in a way, because through that mechanism, being able to declare a state of emergency, governors can bypass rules that wouldn't be able to move quickly enough to respond. So, for example, like they can contracting for buying essential medical supplies to provide for their hospitals, waiving rules so that telemedicine can take place. All sort an unimaginable number of ways that governors needed to move quickly and nimbly throughout the pandemic. Still, on the other hand, we had lots of laws specific to outbreaks and specific to quarantine rules that just don't work in a massive, where everybody's infected more or less, like COVID. They're designed for things like tuberculosis, where there's not a huge incidence, right? But it's a lot of time intensive with people, and contact tracing just for the few cases that you have takes an enormous amount of resources. So we probably should have expected that those kinds of laws would not help us contain the epidemic if it's on such a broad scale like 1918, and that failing those being effective, governors would turn to their emergency power. So that was one thing that kind of surprised me. And then I think the other was, at least early on, a little bit of disarray in terms of the federal government using its full authority to the best of its advantage. One of the things it did an outstanding job. Previously, there had been enough investment in vaccine research that the United States could get out the door those first effective, highly effective vaccines for the coronavirus. I mean, that was just really a spectacular performance by our federal government. So there was, that part is a success story under any scenario. But what we were slower to do is to recognize, for example, that there was a massive shortage of PPE, massive, and that we had stockpiles, in theory, under a pandemic plan, a pandemic flu plan, that should have been adequate. They were not even close to adequate, and the federal government at that point, in my view, should have stepped in to do the purchasing, or at least be able to set the prices through its enormous purchasing authority. Instead, what happened is states, cities, hospitals, nursing homes, everybody's competing against each other trying to buy this stuff, all right? Guess what happens? Prices go up because you're competing against each other. And then the prices go up and up and up. So I think that should have been addressed much earlier. And I think one of the things that tipped me off that this was going on is I got a call from the National Governors Association Council's office. Would convene monthly meetings basically with questions that the governor's staff had come up with. And this question was, can some states band together to buy some of this PPE so that we can, try to offset this competition? And the answer was yes. They were worried about antitrust concerns, but the answer was yes, they could. And so some did, like the Northeast region governors got together and sort of pooled their resources and used that greater purchasing power. But that didn't, that was still competition against other states, and the poorer states always lose out on competitions like that, always. So I think that was a surprise that the federal government didn't act sooner to secure critical supplies like that for the United States. So it's, hopefully that's a lesson learned for the next time.
Yeah, I never thought I would see the day where I would see a guy set up at a gas station selling Lysol wipes and Lysol spray and toilet paper. So that was pretty crazy. But another question about actually your book cover. So as you were writing the book, was that always going to be the book cover? Because I know the mask is now such a big symbol of the COVID, of the pandemic. So was that always going to be your book cover, or did that happen?
No, it happened, I think, because of the really the role that the mask took on in terms of political acrimony and debate. But early on, I had a website for my book, my nascent book, the book to be, and I'd found an image of the face mask with the globe on it. And I really liked that, like a global map. And I really liked it. And so I put it on my website. Later, my publisher saw that. And she said, you know what, let's use that, but let's put the U.S. flag on it since you're writing just about the U.S. So that's how that came about. But we saw face masks being worn across the world well before we were aware of the extent of our own problems. And I think in terms of, I don't really, one of the limitations of the book is that it is just about the United States, and that fact can lead us to forget, that we are part of this global stage, and so we forget that at our peril, that we are, so both obligated and part of this world, where a problem anywhere is a problem elsewhere, and I think we do need to tend to our own house, and at least if nothing else, I'm hoping that the book would raise more awareness, not just of the fact that we've been here before and how our structures are set up so that we might think about changing them in the future, but also this notion that we really are dependent on the health department in a rural county in Nevada, just like we are with Maine and just like we are in Texas. All of these have to work together because that's our defense. The CDC is not out there reporting and picking up on, statistic-wise, where epidemics are brewing, where contagions come from. That's not their job. They can advise, but it's not their job. So we are more safer when our neighbors spend money on their public health, just like they are safer when we in Georgia, spend more money on our public health. And so I'm hopeful that conversation can continue. No.
This is definitely something very unique, which happened. Maybe can relate to the 18-something flu, but it's been over maybe 100 years that we've had such a situation. So I'm sure a lot of countries, a lot of states were not prepared for this. So, but again, if you look at the progress in terms of technology, even in medicine, there's been huge progress. Excuse me. So I'm wondering what's really the huge challenge for the US. I think you explained it also, where we have so many organizations, institutions which are involved. How can we be able to connect? I mean, we can use the technology, like the sharing of data, where the pandemic is so widespread, we can be able to try to contain it. And also in terms of sharing of medicine or protective gears, is there a way that can be coordinated? Of course, at the state level, at the federal level as well.
It's a great question that I think that a lot of the state and local health departments were thinking about is how to better use technology in all sorts of ways, but specifically for how to communicate better. Because they felt like they got behind on the social messaging early on and could never really sort of catch up. So at least in terms of how can we better use technology, already I think health departments are looking at how can we better use it to communicate, because we need to, and if it's a local food outbreak, foodborne illness outbreak, whatever it may be, there's a need to communicate quickly with your local population to tell them what to do, how to keep yourself safe, where to go, if you need help. All of those sorts of things you need to be able to communicate. And I think it's a lesson learned for them that these are the sorts of things that we also need to be paying attention to in terms of resources. I think data sharing is a very important thing that I'm hopeful there will be, so health departments can learn from each other and then also share best practices. But I don't know how to get away from, or I don't know precisely how to solve the problem of this unequal resources. And I want to go back to the tuberculosis example just for a minute, which is some states spend a lot of money on tuberculosis control programs. And fortunately, Georgia is one of them. Spend a lot of money on it. Some states spend zero money on it, and they rely on a very limited amount that comes from the CDC that was appropriated by Congress about 20 years ago. So what do you do in a situation like that where you've got the responsible states, if you will, or the ones that are that have the money to devote to it, and they do devote to it, and they have very well organized and very well run health departments and very good programs, and then in other places not. Part of that may be a disparity of just that we have rich states and we have poor states. But there's got to be something more to it, in the sense that what we've seen over the last couple of decades really is the more federal money that comes to public health departments, the less their state legislatures vote to those same health departments. So it's like we're playing this zero-sum game where the idea was the federal government could help them be better, whereas what's happening has been that some states are just cutting what they devote to public health. So if nothing else, perhaps if COVID could make us more aware of what our public health departments do critically every day before COVID and how important that is, hopefully it's this evening of financing that can help. And I don't know exactly how technology could help with that, other than there's got to be ways to link health departments so that they can better utilize the resources that are available in this country.
Well, thank you so much to our bookseller, Eagle Eye Bookshop of Decatur, Georgia, for coming out this evening. There are still books for sale. And Professor Polly would be happy to talk with you or to sign your books. And above all, thank you, Professor Polly, for coming out. That was really, I think that was a very important talk, because what you remind us is if we don't learn from history, we will repeat it. And indeed, we did repeat some of the same mistakes. And we hope that out of all of this suffering and sacrifice that we have all made, missing our families, losing people, let's hope we learn something. And thank you very much. I think this is an important book, Plagues in the Nation. Have a good evening, and thank you for coming out. Come meet the author.